Okay, Doctor, so could you briefly describe what your role is in Lourdes?
Yeah. Well, listen, I am the permanent doctor. I am the chairperson of our bureau or Office of Medical Verification or Medical Observation, translated from French, of Lourdes, that was created by the bishop of the time in 1883 in Lourdes. Dr. Duno de Saint-Maclou, a man from Britain, was the first doctor permanently present in Lourdes and chairperson of the committee. And since Dr. Duno in 1883, I am now the 15th permanent doctor and chairperson of the bureau. I'm the first non-French. I'm Italian of origin. And what is our job? What we have been asked over this century and 30 years, it was not to be here to build miracles, but actually to try with the maximum possible scientific rigor to try to explain or find an explanation to what might have happened to Mr. or Mrs. So-and-so that has come up to the bureau claiming that him or she has been cured in a way that doctors cannot explain, related of course to the devotion to Our Lady of Lourdes. Now this procedure has brought up, this medical verification has brought up over the past 130 years to have in our archives a bit more than 7,000 cures that had and have no medical explanation from all sorts of domains of medicine, from severely infectious diseases in the 19th and 20th century to cancer, to neurologic diseases, immunologic diseases, and most recently over the past few years, so-called degenerative diseases. What I would like to point out is that our procedure, which is very long, it usually lasts at least 7 to 8 years, and is divided in two moments, one in Lourdes, and I'm personally responsible of it, and another one, it's like a review committee that meets once a year, usually in Paris, called the Lourdes International Committee, composed by professors and chiefs of service or departments of different parts of the world. These procedures, which as I said in the earliest cases might last at least 8 years, will eventually bring doctors and medicine to say that there is no medical explanation on the basis of published literature and clinical experience to explain why that person was indeed cured. This is our role. So you might have noticed up to now I have not mentioned the term miracle. Once that we have medical evidence of a non-explained or exceptional cure, in that case, we hand out those results to the Bishop of Lourdes, and the Bishop of Lourdes sends that chart, that dossier, to the Bishop of the diocese where the cured person lives. And of those more than 7,000 cures, there have been 67 cures that have been recognized as being miraculous or miracles by Catholic bishops up to now only in Europe. I would also like to make out, to point out to our viewers that as far as we know and as far as I know, there is no such institution in any other Catholic or Christian or Muslim or Jewish place of worship or pilgrimage. In other terms, medical verification, sound medical verification, takes place only in Lourdes, as far as I know, as a place related to pilgrimages and devotions and religion, and since 1883, which has made over this more than a century Lourdes be a respected place where scientific evidence or medical evidence is searched for in order to try to explain what has happened to a person that claims or alleges to have been cured in an inexplicable way.
Okay. Could you give us an example, please, of a miracle that's been accepted as official by the Church, the experience of the person before they came to Lourdes and afterwards, and what transpired?
I think it could be very interesting if I gave you the story of Mr. Vittorio Micheli, an Italian of northern Italy. He was doing his military service in the Alpini. When he was 23, in 1962, he came to Lourdes as a pilgrimage that his family, his mother most particularly, absolutely wanted, because he was basically dying of a cancer which was of course not curable. We are in the early 60s. There's no treatment for cancer at that time, and the military doctors didn't want to send him out because he was basically dying. His lower left limb, his left leg if you want, was attached to the trunk only by the skin and some muscles, because there was no more connection between the pelvis and the femur and the leg. We have x-rays of that. Biopsies and histology confirmed that he had cancer. There was a sarcoma of his pelvis. So against all advice, his mother was able to bring him to Lourdes in pilgrimage, and eventually she asked, I must say, because she has told so, we have all the reports, that she came to ask for his son, 23-year-old, to be cured. Now what happened is that Mr. Micheli was indeed cured, and his cure, which followed the times of biology, which about 2 to 3 years later, after 1962, the anatomy of his pelvis and the head of his femur were rebuilt, and again in a normal anatomic relation, although there is a hiring, if you want, of the level between left and right side of a few centimeters. Now, what is interesting of this story, this can help me explain what are the criteria, the very severe criteria that we try to follow here in Lourdes. First of all, we would search the cure of a disease with severe prognosis. Our second criteria is to search for is to make sure that we are in front of a disease which has been cured, but a disease that had a certain diagnosis. We were sure of the diagnosis. Our third criteria would be that this is an organic disease. It's a mainly organic disease. In other terms, we know that there are psychiatric and psychological conditions that can be cured, that are cured, if you want, in places of religion, but we also know how difficult it is to measure in an objective way, and with objective means, a psychiatric or psychological condition, organic. A fourth criteria is that we want to be sure that no treatment, no therapeutics can explain or could be put in relation with that outcome, the cure. Our fifth criteria is that this cure has happened in a very instantaneous and sudden way. Our sixth criteria would be that this cure is complete, and the seventh and last, that this cure is durable in time, is permanent. Now, the case of the cure of Mr. Micheli responded actually to these criteria, and it was 7 years later that the International Lourdes Medical Committee, on the following, let's say, the analogous decision of our bureau in Lourdes, indeed concluded around a written report by a professor of oncology at the time that this cure was indeed unexplainable, unexplained, and exceptional. So this dossier was then handed out by the Bishop of Lourdes to the Bishop of Trento in Italy, and as it happens every time that we come up to a final conclusion after about 10 years that this is an exceptional cure. And it was the Archbishop of Trento that autonomously came out with his decision and has recognized this cure as being a miracle. So there are two phases that I'm always interested in making very clear. There is that of the medical evidence, and the medical evidence, of course, is that the doctors are demanded to search. As doctors, we are taught in universities to be sure that someone is indeed sick, to know what means to treat that disease, and eventually to recognize that that disease is past, that the person is cured. That's exactly what we do in our daily work in Lourdes. These are facts after medical verification. Then, as in all religions, the Catholic Church can interpret those facts. And so a recognition of a cure being a miracle is the interpretation of a fact, of a medical fact, made by the community of believers, the Church, and the Church in 2,000 years of Roman Catholic tradition speaks by the mouth of the successor of the apostles, who is the bishop. So it is the bishop, the chief of the community, that can, if he wants, if he deems so, if he deems the case, comes out officially with a written decree and recognize that cure that doctors could not explain as being a miracle.
Okay, so when was the last miracle declared in Lourdes?
The last cure was officially recognized by a bishop, by French Bishop Emmanuel Delmas in 2011, March 27 this year. Although Bishop Delmas, and we have appreciated his effort, he has recognized this cure, which doctors had defined being remarkable. He has recognized the remarkable character of this cure. In other terms, the Bishop of the Diocese of Angers, France, has not got into the discussion of the criteria that I have mentioned earlier, and he has not used the word miracle, although we are talking of a man that was cured instantaneously in Lourdes, regardless of all treatments, surgical, medical treatment that he had received for a hernia hernia of the disc that he was operated for in 1993 and 1997. After this second intervention on the disc, that is back pain, the origin of all it, things have gone very bad. He got into a syndrome of terrible pain for which he was cured. He was treated for 4.5 years with morphine, high doses of morphine. He had terrible back pain, and he came in Lourdes, and actually he came, and as he was praying for someone else and not for his cure or for himself, he was indeed cured permanently of all his problems, and went back to an absolutely regular life. I think that the originality of the decision of Bishop Delmas on March 27 this year in France is that I think this bishop has understood the prudence of today's medicine. Medicine in the 19th century and in most of the 20th century was very, I wouldn't say arrogant. I am a doctor, and of course I feel I feel the responsibility of what I say, not arrogant, but it was very sure and certain. Now, today we have so much information. We know so many interrelations. We know that most diseases have multifactorial origins and all that. So medicine is today much more prudent in describing the origin of a disease, and of course in trying to treat a disease, and of course also to define a disease as a precise syndrome or so this prudence, this attention of medicine to today's clinical reality, I think, was understood by Bishop. So as we did our job, I mean, medical verification was brought up. We have a complete dossier on this cure that has not been how can I say, explained also by clinicians, physicians that deal daily with back pain and sequelas of surgical interventions on the spine. Yet this bishop has remarked the character of the gift that this person had received by the bounty of God. So once again, as you see, we have the work of medical verification on one side, and then we have an act of interpretation by a bishop, in the case of our church, of a bishop on the other side. And this, I think, is a very, very interesting field. The Bishop of Lourdes, and I totally agree with him, Monsignor Perrier, states often that Lourdes has no monopoly on cures, because, of course, cures, also not explained cures, can happen in so many different contexts, in so many different conditions. And Lourdes has no monopoly either on the apparitions of Mary, that we Catholics believe has appeared to Bernadette Soubirous in Lourdes, but we also believe that she can appear, if she wants to do so, tomorrow morning in any place in the world. What Lourdes has of absolutely unique is that, perhaps because of French history in the 19th century, because of very peculiar conditions of this country in that time, and the church of this country at that time, Lourdes has started a tradition that has no equals in the world, that is of submitting to medical verification all observations that come to our attention, independently of all religious judgment, which means that since 1883 in Lourdes we have the tradition that any doctor, any nurse, most recent, or any health professional that knocks at my door or at the door of my predecessors over this past 130 years, wishing to participate in the discussion, in the definition, in the decision, in the clinical evaluation, he or she is most welcome, not as a Catholic, but as a professional. And indeed, what we ask at my bureau, to welcome any of the professionals that stop during the year to work or to collaborate with me, it's not their certification of a Catholic christening, but it is indeed their card of being members of the board of doctors of their region or their county or whatever. So this is brought really, I mean, to underline, to appreciate the taste of the search of truth, and not of trying to build, if you want, a miracle. Because as I said, that's a job that gets into interpretation and into religion. Just to give an idea, in 2010, I have welcomed that they have signed our register, willing to participate in our inquiry and in our discussions, 2,650 medical doctors from all over the world, 1,700 nurses from all over the world, 350 pharmacists all over the world, about 100 dentists and other health professionals, more than 100 medical students. Now, this body is a very large body, and so I think this is a very interesting place for any doctor or health professional that should happen to see this registration. It might happen in southern France around the Pyrenees, to please knock at my door, and he or she is most welcome to share any idea or information that I could give this colleague, or that colleague could give to me.
Okay, Doctor, I appreciate you've been really busy today, and I appreciate you sharing your knowledge with us.
Well,
thank you very much.
Thank you.
Thank you.